I'm Scott L. Miller. It's the 2nd of June, 2022. It is Thursday, and my week of unmitigated crazy amounts of work continues. Today, though, other than working all day, and then right at the end of the day, Kat actually had her back go out. She had back spasms that were really painful and kind of crippling. Obviously, she's okay now because we're out walking. We're filming this, as always, in the future because we kind of have to. But I wanted to talk a little bit about this, not about her back per se, but because her back went out, and it was, you know, the kind of, when your back goes out, one of the things you can't do is like jump in a car and go somewhere, right? So it's not like having the flu where it's easy to remove it all. It's very difficult to transport you when you're having that kind of issue. So when this happened, this actually became an issue big enough that we wanted to have a doctor take a look at her because we wanted to make sure that it was a muscle spasm or whatever, and getting medicine was a little bit challenging because, you know, the pharmacies close at night for the most part. We don't live in the middle of the city, so sometimes access to things isn't the best, and we're doing this while on a busy road. Let's actually, yeah, we want to cross and go down that sidewalk over there, and there we go. Nothing like filming on Ruben Dario. So what was interesting though is that, you know, we're like, well, we need to call a doctor, and Kat's like, oh, that's so expensive. And that's such an American mentality. Oh my gosh, the traffic. It's such an American mentality to think that you can't get medical care because it'll be too expensive. And that's not a thing here at all. And it takes a while to internalize that medicine and medical professionals are at your disposal, and they're there for your health. And they're not there to gouge you and to try to find ways to make millions of dollars off of your risks, right? Things you don't control. And so we're like, well, we can't take her to a doctor. Then we didn't have a doctor that we knew, so we called around and we found a doctor that would do house calls, which is actually a really common thing in most of the world. Doctors come to you because that's what makes sense. If you're not feeling well, why are you traveling? If you have COVID, why are you going to a central place to infect other people? That makes no sense. If you have the flu, you don't want to infect other people. If your back goes out, you can't travel. If you're bleeding heavily, you need to stop the bleed, not go sit in a waiting room, right? None of these things. There's times where going to a clinic or going to a doctor, going to a hospital makes sense, but it's not the average stuff. It makes way more sense for a doctor to come to you. If you're American, that sounds crazy. If you're anyone but an American, Americans sound crazy. Of course doctors come to you. That's their job, your health, not your job to cater to them. So here, we called a doctor and a nurse. They both came over to the house. They were there for probably 45 minutes, maybe an hour. Yeah, easy. They brought an IV. They had equipment and medicine and all kinds of things. And they stopped by pretty quickly. It didn't take them long to get there at all. And buenos dias. And the whole thing cost, and this is where it gets really interesting because obviously there's no insurance and this is a luxury care, so you are going to pay for them to come out, and that came out to 2,200 Cordoba, which is roughly $80. So that included a doctor, a nurse, and the IV and 4 different medicines, plus they wrote some prescriptions, and the whole thing was $80. Probably less, probably more like 75, 78, somewhere in there, but 2,200 cord, you can easily just go grab a calculator. 2,200 divided by 35, that's how it comes, you get the USD out of that number. For that level of convenience, for that level of care, to be able to get that, and then the next day we had to run and get 3 prescriptions from the pharmacy, and that ended up coming, I heard, to about $30. So the entire thing was around $100 to $110 after everything was said and done for multiple days of care and all kinds of things. And while doing this, we also said, well, what if she has to go to the hospital? We can't just throw her in a car. She's gonna need an ambulance. And so the question came up, how much would an ambulance cost? And everyone's like, what do you mean? Ambulances don't cost anything, they're free. What? Yeah, the ambulance is free. And so I'm sorry, it's so different, it's so confusing. Now hold on, we're filming this actually on Monday, and it's Dia de los Niños, and this is in El Centro, they've got this thing set up where you can come and get pictures taken with the family for the holiday, and we're gonna cross real quickly here before he runs us over. Or he's gonna show this here. It's pretty cool. It's like, I don't know much about this holiday, so on Monday I'm gonna try to get some filming done that's a cake shop, of the Dia de los Niños activities. We'll see what I manage to get, but that is my plan. I have a lot going on this week. It is pretty crazy, and I just found out that it looks like I'm going to be going additionally to my trips to El Salvador, Honduras, and Guatemala that are coming up. I'm also, it looks like, going to Costa Rica immediately the day after those trips. So literally the day after. I get back on July 4th, leave again on July 5th. That's pretty crazy, and that's like less than 4 weeks away before I even start the journey. So I've got a lot coming up that's gonna be really cool for this channel. But I just wanted to talk because really our whole day was dealing with work all day, and then Kat's back in the evening. But the whole medical thing, every time we've had to do some level of medical anything here in Nicaragua, it has been so fantastic. Not only is the cost low and the care really good, but it's also the way that the care is delivered. The fact that you don't pay for things that don't make sense for you to pay for. The fact that every bit of the system is designed to help you have better health care. When you go to a doctor, you don't make an appointment, you just go. They see you as fast as they can, generally really fast. Sometimes you have to wait, but it's still a day before you would see someone in the United States. If you really need somebody, they come to you. If you need an ambulance, it's free. You don't get screwed over because you have some emergency, and so it's just, it's so much better. It's so much different. The approach, the mindset to healthcare here is so fantastically different and so much better. It's just, it's crazy. So I wanted to tell that story because every bit of that experience, other than Kat writhing in pain, was really, really amazing. And it's far from our first healthcare incident that we've had here. We've been here for a while. We've had to see within our group, people have had to see about heart conditions, people have had to see about broken bones, people have had COVID shots, and all of it has been very consistent and very similar, that the experience has been low cost and high care. All things that completely shock us when coming from North America. It is a different world, and healthcare is one of the reasons you come here. You don't come here in spite of the healthcare. You come here because of the healthcare.
Yes.
Or, to look at it another way, you flee the United States because I have never witnessed worse healthcare anywhere in the world, right? Canada's not great, but it's still better. Europe is so much better. Even here, where there's very few resources, it is better in most cases. There are some large things. I will mention caveats, right? If you have, other than burn units, we have the best burn units in Northern Latin America. But if you needed like acute cancer care, this may not be the place you want to get it. But when you need cancer care, it is not an immediate thing. I mean, you may want it in the next day, but you can get on a flight from here and be at the best cancer treatment centers in the Western Hemisphere in a matter of hours down in Medellin. If you need specialty care in Mexico, it's only a few hours away. Same as in the US, if you needed to be transferred to another hospital, that can happen here too. But for general care, for acute care, for everyday care, it is absolutely fantastic here. And we don't even have one of the cities with the big, really good hospitals. We are in one of we're building the big new hospital. It's gonna be fantastic here in León, but the newest ones are in Managua and Chinandega and up in Nueva Segovia, where they just built them up in the mountains. Thanks for joining me. Please remember to like and subscribe, ask your questions, leave your comments below, share on social media, get the word out about the program, because we have no way to promote ourselves other than you guys. All those likes, all those subscribes, all those comments, they help get people to see the show. They tell YouTube that you appreciate this content and want to see more of it. Thank you very much, and I will see all of you tomorrow.